What is obstructive sleep apnea? Obstructive sleep apnea is a stoppage of breathing while asleep for more than 10 seconds associated with a drop of oxygen for more than 2% of the saturation. And the reason for this is an obstruction in the airway. So, if you think about how we breathe and the airway, you may notice that we can breathe through our nose or through our mouth. And both these routes will lead to the vocal cords, after which the air comes into the trachea and into our lungs. Now, the root cause of obstructive sleep apnea is specifically that region. So, from the larynx to the back of the nose. This is an area that is used for a dual purpose. It's used for breathing and it's used for swallowing. So whenever we want to eat and to swallow something, we use the muscles of that area to push food backwards. This muscular area, as all muscles in the body, will lose control over it when we're asleep. So whenever we enter into the stages of sleep, be it superficial, deep, or dreaming phase, we lose control of our muscles. And when we lose control of these muscles, this area sags or collapses sometimes. So in some people, this area really blocks completely. And when it blocks, naturally the air which is filled with oxygen will not enter into our lungs. And when that happens, the oxygen in our blood will drop by more than 2%. And when it arrives to an alarming level, the brain has a defense mechanism by which it wakes up. It wakes up a little bit. It's called a micro-arousal. So we don't recall these arousals. We don't feel them. It's not like as if we're going to the bathroom or we're waking to turn to our sides. It's just a small arousal, a small awakening that leads us to the opening of that airway, after which we breathe normally. And when we breathe normally, the oxygen will go up, the brain will sleep again, and then the collapse happens again. So, to define it in one sentence, obstructive sleep apnea is a stoppage of breathing for more than 10 seconds associated with a drop of oxygen caused by a collapse, an obstruction of the airway that is behind the mouth, where the tongue and the palate are from the front and the back of the mouth is from the back.